Imagine you're a healthcare professional. You're dealing with patients, deciphering case notes, and making crucial decisions every day. Now, imagine having to translate all that into a formal letter. Challenging, right? That's what the OET Writing Criteria is all about, and why it's so important. In the OET Writing subtest, you'll find yourself tasked with writing a letter based on given case notes. This task is designed to test your ability to identify the genre, style, and appropriate use of polite language for the document and recipient. Before you even begin writing, it's crucial to draw from your existing knowledge. The world of healthcare is full of various written formats, like emails, memos, formal letters, discharge reports, case notes, summaries, and ward notes. Today, we'll focus on the formal letter. Formality is key when writing a formal letter, memo, or report. In the OET writing assessment, it's likely you'll be asked to write in this manner. So, how does it work? Picture this. You're examining a patient, Mr. John Smith, a 30-year-old construction worker. He's married with one child, doesn't smoke, and occasionally consumes alcohol. His medical history includes a childhood appendectomy and a recent diagnosis of acute appendicitis. From these case notes, you need to compose a referral letter to Dr. Emily Brown at City Hospital. The letter should be around 180 to 200 words and expand the relevant notes into complete sentences. Your letter might look something like this. Dear Dr. Brown, Mr. John Smith. I am writing to refer Mr. Smith, a 30-year-old construction worker, who has been diagnosed with acute appendicitis. He has been scheduled for an appendectomy at the earliest convenience due to his severe abdominal pain, nausea, and vomiting. Mr. Smith has a relatively clear medical history with only a childhood appendectomy on record. He doesn't smoke and only occasionally drinks alcohol and is generally in good health. I have advised Mr. Smith to refrain from eating and to avoid strenuous activities until his surgery. I kindly ask you to prioritize his case for surgery at your earliest convenience. If you require any further information, please don't hesitate to contact me. Yours sincerely, Doctor. And there you have it. A structured referral letter for the OET writing subtest. Remember, it's all about practice. Use formal language, expand the notes into complete sentences, and ensure your letter is clear and concise. If this video was helpful to you, make sure to like, share, and subscribe. Keep an eye out for more tips and strategies for the OET exam. Happy studying and best of luck with your preparation.